Greetings and Happy New Year to everyone. Welcome to this first Women's Health Awareness Real Talk webinar for 2024, Demystifying Autoimmune Diseases, What We All Need to Know. I'm Joan Packenham, Chair of the Women's Health Awareness Steering Committee and Director for the NIEHS Women's Health Awareness Program. On behalf of the National Institute of Environmental Health Sciences, the Women's Health Awareness Steering Committee, and our co-sponsors, the Durham Alumni Chapter of Delta Sigma Theta Sorority Incorporated, Durham Alumni Delta House, and the North Carolina Central Department of Public Health Education, we are extremely honored to have each of you with us this evening and excited to bring you this important program. I want to begin by first announcing that it is Radon Action Month and that our governor, Roy Cooper, has proclaimed January 2024 is Radon Action Month for North Carolina. He has done this to raise the public's awareness of radon, to promote testing and mitigation for radon, and to reduce the risk of lung cancer. Action implies that we not only listen to learn, but we do something. We invite you to listen to our podcast on radon awareness by visiting the Women's Health Awareness website, and that website should be put in the chat tonight. We also ask that you order your free radon test kit. Please go to the NCDHHS website to order your radon test kit. It is important that you test your home yearly as your home settles and cracks and crevices can develop without your notice. Radon is a gas and can seep in your home through these new cracks and crevices that you may not be aware of. So please do not delay. Listen to the podcast, order your free radon test kit as soon as possible, as supplies for the test kits are limited and they go very quickly. Test kits will be available starting January 15th. Tonight's Real Talk webinar is titled Demystifying Autoimmune Diseases, What We All Need to Know. The overarching goal of this webinar is to understand the impact of autoimmune diseases in communities of color. This slide quickly highlights our agenda. The session chair and moderator for this evening will be Dr. Adam Schiffenbauer. He will provide the objectives of this important information session and introduce our speakers for this evening. I'm excited about this important session as I feel that it increases our awareness about autoimmune disease and helps us to understand the contributing factors and to recognize the signs and symptoms. Quickly, a few reminders that we don't want you to forget. This session is being recorded and it will be uploaded to YouTube. Closed captioning services are available throughout the webinar. And for evaluations will be sent immediately following the webinar through email. For completing the webinar and evaluation, you will receive educational contact credit hours for your participation. A few webinar housekeeping details. The Zoom Q&A is located at the bottom of your Zoom window when it is full size. That is important. The window has to be full size to access the Q&A functions. Use that function during the Q&A session or if you have questions for the staff. Use the thumbs up icon to like a question, as this gives the question priority ranking during the Q&A session. And if you would like to send your question anonymously, please be sure to check the Send Anonymously box to conceal your name. I'm honored tonight to introduce the chairs of this session, and I thank them for leading us to these distinguished speakers tonight. Dr. Lisa Ryder, Head and Senior Research Clinician for the Environmental Autoimmunity Group of the Clinical Research Branch at NIEHS, and Dr. Adam Schiffenbauer, who is with us tonight. He is the Deputy Head and Associate Research Physician for the Environmental Autoimmunity Group of the Clinical Research Branch at NIEHS. And I just wanted to add that the mission of the Environmental Autoimmunity Group at NIEHS is to understand the mechanisms for the development of autoimmune diseases so that this group and its members can extend healthy life and reduce the burdens of illness and disability. At this time, I introduce you to my friend and colleague, Dr. Adam Schiffenbauer. Adam?
Thank you, Joan.
One moment before you begin, this is the interpreter. The other interpreter is needs to be made as a co-host. That's Rivka. Perfect, thank you.
Thank you, everybody, for coming out on this evening for this very exciting topic. It's near and dear to my heart, and I think lots of other folks here. So I wanted to introduce our first speaker. I'm very honored today to present our first speaker, Dr. Sarfaraz Hasni. Dr. Hasni is an adult rheumatologist and serves as the chief of the Lupus Clinical Trials Unit and is director of the Lupus Clinical Research Program at the National Institute of Arthritis and Musculoskeletal and Skin Diseases. His research interest in lupus involves work on early phase clinical trials. He's established the DC Lupus Consortium, a group of rheumatologists, physiatrists, nephrologists, and other healthcare providers doing lupus clinical research in the greater DC area. Of note, particularly for today, he received the William G. Coleman Jr. PhD Minority Health and Health Disparities Research Innovation Award, and that was in recognition for his project Increase Minority Participation in Clinical Research through Peer-to-Peer Mentoring Approach. And the goal of that project was to bolster the participation and representation of racial and ethnic minority groups in clinical research of systemic lupus erythematosus, and he had received that back in 2021. So I don't want to take up more of his time. So thank you for speaking to us today, Dr. Hasni, and we look forward to hearing what you have to share.
Thank you. Thank you so much, Adam, for that very kind introduction. And thank you to Dr. Peckham and Lene and rest of the organizers for inviting us for this very important and interesting topic. And I'm really honored and grateful to have this opportunity. So I'm going to share my screen and maybe just talk a little bit in terms of demystifying autoimmune diseases, and then using some of the slides, and of course we will have Q&A afterwards. So so as Adam said, my primary research focus is on lupus, and I'm very interested in minority health and health equity and health disparities, and that's my passion, which is as you may see through the presentation, that it is quite closely related to autoimmune diseases. So what are autoimmune diseases? I'm sure a number of you on call right now either know somebody who has autoimmune disease or may themselves actually have autoimmune disease, or may have a general curiosity about what is this term that is being quite commonly being used these days as autoimmune diseases. And then I try to use a little bit of a photograph to just sort of impress upon a point, and we'll just come back to that in a minute, that why I chose to show the autoimmune diseases like that. So before we talk about autoimmune diseases, let's pause for like a minute or so and say that what is a normal immune response. So the immune system, or the host defense system, is our body's system, which is built basically just to make sure that we are healthy, and then the environmental pathogens, the bacteria, the viruses, the parasite, and what have you, if they attack our body, then the immune system gets quite functional and active, and then it takes care of it. But at the same time, the immune system is smart enough to make sure that it does not affect our own body. It only attacks the bad guys, and our own body tissue and cells are protected. So, for example, if you look at this slide, the bacteria or viruses here, or the parasites or other substances that can injure our body, either they come in contact with our respiratory system, or our intestinal system, our stomach or esophagus or gut, If they are small enough, then they will go into the bloodstream and then they infect the blood cells, and they go inside the cell. Or if they're large enough, they will just stick to the mucosa or the respiratory lining or the intestinal lining. And when that happens, it triggers the immune response. And as a result of this triggering of the immune response, or the consequence of the immune response, is that the infected cells, if the bacteria or the virus in the cell gets destroyed, and the bacteria and the virus as a consequence get destroyed also, or if it is stuck to the epithelium or the lining, then it gets it dies because of release of certain chemicals and so forth. But at the same time, our body is kind of protected. But what happens in the autoimmune diseases, that the immune cells, which are supposed to protect our body, they become sort of dysfunctional, or they don't do their job properly, and then they start to attack the body cells and body tissues, and that's pretty much what happens. That a misdirected immune system that causes one's own immune system to attack the self, and that's why I sort of chose this figure here, that sort of self-destruction. So our own body cell, which are supposed to not attack us, then they start to attack us. So when we talk about autoimmune diseases, the list is ever growing. When way back when we only have a handful of autoimmune diseases, but as we continue to learn more and more about it, the count went up to 80, and now most recently it is being said that there are over 100 different types of autoimmune diseases. And as you can imagine, since the immune cells are everywhere in the body, and then when they become dysfunctional, they can attack any part of the body. So autoimmune diseases can attack and can affect and damage any of the body's organs, and can result in diseases. But in broad terms, we divide them into the autoimmune diseases which are localized, which means that they can only affect one part of the body or one organ of the body. For example, the example here is the thyroid, which a lot of you may be very familiar with, that when the immune system affects the thyroid, the autoimmune thyroiditis or Hashimoto thyroiditis, you may have heard of that term, can cause damage to thyroid and then results in a dysfunctional thyroid. But then the other set of the autoimmune diseases are called more systemic autoimmune disease, which means that not only one organ, but multiple parts of the body are involved. And the prime example of that disease, or the sort of the quintessential autoimmune disease, which systemic autoimmune disease is lupus, or systemic lupus erythematosus, or SLE, where skin, joint, kidney, brain, any part of the body can be affected by this autoimmune disease. The question comes that who is at risk of autoimmune disease, who gets the autoimmune disease, and why somebody gets the autoimmune disease. I think Dr. Lanata is going to talk a little bit more in her talk about those things. I'm just going to touch a little bit about who is at risk of autoimmune disease. So this, I was looking this up, and then the Autoimmune Disease Foundation have put this up. They say they're estimated about 50 million, and some have estimated even more, some have estimated less. So don't kind of bog down with this number, but there is a significant number. Some say 1 in 10 of Americans have some kind of autoimmune diseases, and it's based on how we define it and how we talk about it. But it's a significant problem. It's a major health issue, not only because of the numbers, but also because the chronicity. So the autoimmune diseases usually happen in younger people. So you can imagine that you have a chronic illness, and as more and more young people are getting affected, then the number of people around the U.S. will be quite a bit of people. So it's a major health crisis. They do tend to cluster in families, even though some autoimmune diseases we see that more clustered in the family, some not as much. But there is at least some genetic component to it, and we see that if one person in the family has autoimmune diseases, the others are more likely to have autoimmune diseases. And the other interesting fact, which I think very relevant to the audience today, is that autoimmune diseases predominantly affect women. On average, they say that about 75% of the autoimmune diseases are found in women, and it's one of the top 10 killers of women under the age of 65. And then I'll show you the next slide where you get an idea that that certain autoimmune diseases are much more common in women and some are not as common in women. So as you can sort of guess, the pink bars here are representative of women, and sort of the light blue bar are representing men. And some of the autoimmune diseases, such as Sjogren disease, Sjogren syndrome, or SLE or lupus, are extremely highly common in women and rather uncommon in men. So they say that about out of every 10 patients that we see, nine in my clinic, for example, in lupus patients, out of every 10 patients I see, nine are women. And most common, not only that they're women, most of them are very young women and they're childbearing ages, so usually in teens and 20s. That's when most of the women get diagnosed. But if you kind of walk through this slide and then you go to the extreme right, some of the diseases, for example, the diabetes, which is also considered as an autoimmune disease, somehow the prevalence is a little bit more. The ulcerative colitis or the inflammatory bowel diseases are somewhat equal in both men and women. So it's in a spectrum, but overall, autoimmune diseases are present in about the patients predominantly are women. 75% of the patients in all autoimmune diseases, when we look at everything, is 75%. So why is that? I mean, one obvious thing is that there are hormones, the sex hormones are different in men and versus women. So there is a role of estrogen, which is considered to be very pivotal or important in terms of how which makes women more susceptible. And we don't have enough time to go more in detail, but it's rather complicated. But and then the genetic component, the X chromosome itself, having two X chromosomes put them at a higher risk. And then the immune system more recently have found to be different. The immune system in men is for lack of a better term, is somewhat immature, and the immune system in women is supposed to be more mature immune system, and it is more hyperreactive just to protect them, so the women can fight the diseases better than men. But at the same time, because of their immune system is so hyper or so mature, then it can sometimes become hyperactive, or it can has a propensity to become more hyperactive, and that can lead to women being more susceptible to autoimmune diseases. And then more related to the environmental effects of autoimmunity is that environmental exposure is different in men and women, because men are exposed to some degree, at least more so in the previous years, but more recently may not be as true. But environmental exposure in men and women are different, and the response to those exposure in men and women is different because they have a different kind of exposure. And then the hormonal differences and the genetic differences come into play, and all of this influence on autoimmune diseases leads to this gender difference in autoimmune diseases, where predominantly women get more autoimmune diseases than men. I'm just going to close out by saying a few things about lupus, which is sort of the quintessential autoimmune diseases. So not only that women are more commonly affected, but we find that the racial and ethnic differences in autoimmune diseases, and it is very much more predominantly in lupus, where up to 1 in 250 young African American women in the United States have lupus, whereas if you look at white population, it is 1 in 1100 or 1 in 1200 women who have lupus. So young African American women are significantly higher at risk. And not only that, that it affects them more commonly, the disease that they get is at a much younger age as compared to white women. And not only that, they get it at a younger age, they get it much more severe. So a Black female getting lupus the disease is much severe as compared to a white female of the similar age that will get lupus. And in the end, I just want to show some statistics that Black women is 3 times more likely to develop lupus. They're not only they're more likely, they're increased risk of hospitalization. They're more likely to develop lupus kidney disease, at least 4 times more likely. And they are 3 times more likely to die from lupus. On an average, if both a Black and a white female get lupus at the same time, the Black women will die about on average 13 years earlier than the white female who got the lupus at the same time. So in a nutshell, autoimmune diseases are diseases where our immune system becomes dysfunctional. It attacks our own body. It can be localized to one organ like thyroid, or it can be systemic, where it can involve multiple organs, multiple parts of the body. One of the most common systemic autoimmune disease is lupus. Diseases are much more common in women. They are common in women at younger age, and there are multiple reasons because of that: hormones, X chromosomes, and so forth. And the last point was that that certain races, especially the Black and Hispanic women, are much more likely to get autoimmune diseases, and when they get the diseases, it is much more severe also. So with that, I will end, and I just again would like to thank you all for your attention and for joining. And I know that there are question and answers, and we're going to get to them later on. But I will yield back to the moderator, Dr. Adam Schiffenbauer. Thank you so much.
Thank you so much for that. And that's right. We'll get to the questions at the end of all of our talks today. So I want to introduce our second illustrious speaker for today, Dr. Christina Lanata. Dr. Lanata is an adult rheumatologist currently serving as a physician scientist in the Genomics of Autoimmune Rheumatic Disease section of the National Human Genome Research Institute. Prior to that, she was a co-investigator on the California Lupus Epidemiology Study. And her research was focused on the interplay between genetics, environment, on systemic lupus erythematosus outcomes, with an emphasis on addressing health disparities. And one of her new projects is collaborating with researchers and medical professionals in Peru to understand understudied populations there. And I want to get us back on time, so I won't talk anymore, and I'll let Dr. Lanata take it away.
Thank you, Adam. Let me just pull my slides real quick. And okay. So yes, thank you for the invitation and for the conversation, and we hope that this is helpful to all of you. So I am going to continue the conversation talking a little bit about what factors are contributing factors or environmental factors that are associated with autoimmune diseases, and as a person, individual, when should you suspect that you might be having an autoimmune process, or one of your loved ones might be having one. So I wanted to just start with a lot of what Dr. Hasni has really talked about, that really an autoimmune disease, or in this fancy word we call phenotype, or like expression of this balance of the immune system, can present in very different ways. We know as physicians that every person is its own universe, and it's its own manifestation of how this balance is going to manifest. And it really is the combination of our, background genetics. I mean, we all are born with some inherited wonderful things, but also not so good things from our ancestors. And then we encounter things in our lifetime that might, be what we call triggers for this system that's supposed to be in balance, then breaks tolerance, that's how we call it, and starts causing an autoimmune disease that the immune system is very smart. When it's convinced that it's found an enemy or a target, it really won't stop. So then it's just programmed. So then when that process kind of takes place, it really takes hold, and then there's a disease that is chronic, and it's what we call autoimmune diseases. So it's this whole combination of genetics, what you experience in life, what you're exposed to, and all this interplay, something that we call epigenetics that we won't talk about, but there's a lot of that area of how the genes and environments basically interact to cause this regulation. So we know a few of these factors. Sun exposure is a one that's been very clearly described and associated with not all, but some autoimmune diseases that affect mostly the skin, such as Sjogren's disease, lupus, myositis, scleroderma, and UV light for some reason can cause DNA damage in circulating lymphocytes and could cause reactions at the levels of skin, and really can start as a skin manifestation, but really can trigger a whole systemic autoimmune disease. So we definitely know that UV light is something that can really trigger this process. And if you think of the immune system, if you have this predisposition to maybe go a little overboard or like hyperactive or really trigger something that you can't stop, anything that will rattle the immune system enough could also trigger it to start this process of disease. And this could be really very widely varied. We know, for example, systemic infections like viral infections or bacterial infections that really stress the body to defend itself can then activate a process where then you're left with autoimmunity. There's a lot of data, for example, in Epstein-Barr virus, an association with lupus, and more recently with multiple sclerosis. There's lots of papers last year about it. And we're even learning that COVID, people that have gotten COVID and severe COVID, there's a few recent papers showing that there's a little bit of association with rising autoimmunity in countries where they have all this data really counted for their entire population. So, systemic infections, we know that can trigger autoimmune diseases in people that have this, genetic risk factors. Dr. Hasni really talked about estrogen as a main trigger, and it's particularly some diseases. So, for example, during puberty, there's a rise in the onset of lupus, for example, as Dr. Hasni has talked. And then, when the system feels that it's under threat, so some form of stress, that can also be enough of a trigger for this pathogenic process to start. And this could be from like a physical stress, like a car crash, where there's like a lot of, severe tissue breakdown, you're almost died, like that level of physical life threat. But we are learning more and more of the importance of psychological stress and the onset of autoimmunity. There's been really some fascinating papers in the last 5 years, really asking people that have autoimmune diseases if they had any history of severe trauma in children, like in childhood, or traumatic experience or chronic levels of daily stress. And the signals in multiple disease processes in multiple cohorts around the world is there, especially with, people that go to war, like PTSD. There's been this association with then rise in autoimmunity. And, we're also learning about stresses such as, systemic racism can also, cause these really, every little factor of hardship at the level of stress and psychological stress is showing to be a strong trigger for autoimmune diseases if you have, again, a little bit of this genetic background per se. And I also wanted to talk about just the environmental exposures that we're all under every day. And, it's getting to be more of a toxic world these days. And we are kind of on a daily basis exposed to water pollution, air pollution. Our diet depends on what we're buying, where we're eating, can contain a lot more than just nutrients. We know that certain medications or recreational drugs, can also trigger the immune system. Well, smoking is, of course, the classic exposure that we know by far has been proven to be a significant risk factor for autoimmunity. It's just it's like lighting the fire and putting a log. If you like, smoking is really kind of one of the worst triggers for autoimmunity. I've talked a little bit about infections, and just behavior and lifestyle in general are highly contributing to, again, rattling this system to overact and then start something that we unfortunately have not learned to reprogram back to normal just yet. And I just wanted to mention a few interesting studies that have just came out in the recent years. So these exposures to these chemicals that we're exposed to every day in terms of our food, like pacifiers, flame retardants, phthalates in cosmetics, you name it, there's like a never-ending list of new things we have to worry about. But we're labeling xenobiotics, which are a substance foreign to the body, like we didn't make it, man made them, not nature. And these have been associated in big studies with what we call ANA positivity. ANA stands for antibody anti-nuclear antibody is one of the first signs that your body's mounting an autoimmune phenomenon. So it's the hallmark of certain ANA positive diseases, not all of them, but lupus, Sjogren's, scleroderma, a lot of these diseases have this antibody. And again, this exposure to these substances have been associated with increasing ANA positivity. And there's also been some very interesting studies looking at pesticide exposures of people that actually worked with pesticides and were exposed to these substances were associated with increasing autoimmunity in terms of the presence of these antibodies. There's been specific compounds that have been found at a higher risk. There's this fumigant methylbromide, petroleum oil distillates, and particularly for lupus, the exposure to this herbicide, metribuzin. The general gist is that I think overall close contact to pesticides might not be a good idea for people that are maybe at risk for lupus or autoimmunity in general. There's all these other chemicals, persistent organic pollutants, toxic solvents, toxic heavy metals that have been associated again with dysregulating the immune system, mercury, lead, cadmium, arsenic, for example. And these are contaminants that you can find, unfortunately, in water when there's no good water systems, and sometimes in cosmetics and food, etc. And there's a whole new category of compounds called endocrine disruptors that, again, these are man-made produced chemicals that may actually act and interfere with our own hormonal system and are not, inert, but they're actually biologically active. And we're learning a little bit of their effects, not only on immunity, but in cancer. And there's a lot of work trying to figure out what the daily exposure to these substances at the end of the day does to us. So anyway, so really in terms of all this preventive measures, there's not like really a guideline. I think, pesticides has been a strong signal, particularly in the recent years. So I would avoid, if you can, working with pesticides directly. And, there is a group, a website, I don't know if people have encountered it, which is the Environmental Working Group, that report a list of dirty dozen fruits and vegetables that you should maybe try to avoid because they're really embedded in pesticides. So if you can, and it's expensive to buy organic, you can at least try to avoid these dirty dozens, which are mostly exposed. Having said that, there's not any evidence-based, clinical trial that has shown that doing these eating organic will, avoid autoimmunity. I don't think there's anything out there, but it's just general sense recommendations. We also really stress the use of sunblock, and stress management is hard because, life is really stressful and we all have our life experiences, but we really, if you have a lot of family history of autoimmunity, just really being mindful that that is something that you need to maybe pay a little bit more attention to. And because some infections, we know that are major triggers, we do recommend vaccination whenever possible if we have them, just to avoid these maybe risk factors. And just general good sense of good sleep is also good, just to again keep the system in balance. And exercise has been showing to be wonderful medicine as to an anti-inflammatory way of controlling, again, the signaling with the immune system. Very beautiful work coming in the translational field about the benefits of exercising. Not that, it's we don't know, but we're just proving it more molecularly. So these are kind of general guidelines. And in the last few slides, I just want to say, well, how do I know if something like that is happening to me? The problem with autoimmunity, it's going to be the great masquerader. This image, you can see different things. And, there's always, they could be an autoimmune disease sometimes gets misdiagnosed for years, or it can be confounded from even like an infection to mental health illness. And at the end, it was actually an autoimmune phenomena. So it's sometimes hard to really know what's what, but I'm going to talk about the few things that really should prompt you to think about it at least, and get some thoughtful decision to look over a few of the things that are happening. So one of the most common features of most autoimmune diseases is something that we call inflammatory arthritis. And this is, well, we're all going to have joint pain when we age, unfortunately. So arthritis happens to a lot of people, and the majority is just wear and tear arthritis when we're like basically wearing off our cartilage as we age. And inflammatory arthritis is something completely different. It is the manifestation of a autoimmune attack. So the immune system is there kind of chipping at your joints. So it's completely different, and it does manifest differently in terms of symptoms. And when we mean by that, is anyone can actually really, if they, in terms of symptoms, can differentiate when should we worry. And these are when really we see swollen joints, like they fill up with fluid, they're warm, they're painful, or they're throbbing. And they tend to be worse in the morning. It's just, that is kind of like the key feature of inflammatory arthritis is basically the morning is the worst time of the day. And a lot of people report stiffness that can last from a couple of hours, not just 15 minutes, but hours that require people to just like get out of the stiffness. And that's classically a classic sign of inflammatory arthritis. And it doesn't have to be always symmetrical, but most of our diseases does present like very symmetrical, like both hands, both feet, both knees. It's just like a symmetrical pattern, not all the times, not all diseases, but in general, it's a trend. And it can happen in the hands, in feet, knees, elbows, shoulders, also neck. And there's a particular disease subgroup of autoimmunity that affects the back that way. And it's not just back pain that is worse with exercise. It's like the same characteristics, worse in the morning, associated with stiffness. And because it's inflammation, it's inflammatory arthritis, a lot of these not fully respond, but will respond with some plain anti-inflammatory meds, for example, ibuprofen or Tylenol, really, or something that works at the level of inflammation will improve to a certain extent, but there's an improvement with anti-inflammatory medicine. So that is a very strong sign that there's something that you should prompt to think that maybe I should see my doctor, or might be just out of not the regular sort of joint pain, that might be just wear and tear. The other classic symptom is what we call photosensitivity, or rashes in the skin associated with sun exposure. These are a few pictures. And when we mean like a rash, it's a rash, it's not like a sunburn, but it's a raised, elevated rash after a sun exposure that lasts a few days. So it really is like a bit of it's not just a simple sunburn. And it really is specifically located to where there was sun exposure. As you can see, some of these pictures where the skin that was not sun exposed is not, and then it could be really red, as here in the picture below. But it can affect the hands and also any area really that has been exposed to the sun. In lupus, we have this famous sign called malar rash, and you can see it in the right side, where it happens on the face, and it really spares areas that are not so much sun exposed, which is called the nasolabial fold, because these are not as exposed to the sun. So this is also a significant kind of red sign to think for any of our diseases, and it should be looked at. And for the most part, these diseases are chronic, so these are not gonna last for 1 or 2 weeks. These are unfortunately things that are started to develop and will likely continue. And because there is a component of inflammation, they're gonna have a little bit of systemic symptoms, what we called, which can be weight loss, low-grade fever, a lot of fatigue. Because the immune system is compromised, sometimes people have swollen glands as part of their process. Because there's so much inflammation, you can even have mood disorders. So that's why it's sometimes confusing and people don't get taken seriously sometimes because they might think that someone's depressed because they're tired and moody, et cetera, but it might be something more. And another sign that we take into account is like when people started having hair loss, like skin, like empty patches of skin in the scalp, that you start having patches of hair loss. That's also one of the signs that this could be one of our diseases. Additional factors that are helpful, as Dr. Hasni said, for the most part, there's a strong correlation with family history. So if you have a family history and any of these things are happening to you, that's a stronger sign that we should really evaluate you for an autoimmune disease. And also, if things get better, or there's a diagnosis of an infection, or, you get to a diagnosis and you're done. But if there's no diagnosis and people have not really understood what's going on, they're likely to think about an autoimmune diseases. And again, these are things that are likely to be there for a while, not just, a few days and then they're gone. So if the first stop usually is the primary care physician, and the primary care physician should be able to really take a look at these things and be the first pass to really understand if there is or there's not immune dysregulation with a physical exam to just see the things that we've been discussing. And then there are really easy labs that are part of the routine checkup that can tell us a lot very early on whether there's a systemic autoimmune inflammatory process going on. For example, anemia is one of the signs that you might be mounting a inflammatory process for a while. Sometimes, there's something called the lymphocyte count. When it's low, we see that's a telltale sign that also it might be an autoimmune disease. There's actually measures of systemic inflammation, so we can measure if there's a systemic response in your body, and these are things that the primary care doctor can do. These tests are called CRP and ESR. They're just two tests that are very easily available for every physician. And then any abnormalities in your blood counts also should prompt us to think of an autoimmune disease. We should check to see how the kidney is, because sometimes, no one really complains of the kidney, and then the kidney might be suffering. The only way to know that is with a urine test and a creatinine test. And, if there's enough there, your primary doctor can start with initial, what we call autoimmune labs, which are this test that I've been talking about, the ANA test, and some other factors for arthritis to see if it's, for example, rheumatoid arthritis, another very common autoimmune disease. And this is like a very great workup to start. And then if anything of this is abnormal, then the next stop should be, of course, a referral to a rheumatologist. But these are really helpful, easy to do blood work or urine tests that any physician should be able to do that really pick up on these diseases pretty early. So that's all I had for you guys. And excuse me if I went over time, but I'm sure we'll have a lively conversation. And thank you for your attention.
Thank you so much. So we're going to open it up to questions, which we've got in beforehand that people submitted, as well as you can put them in the Q&A box. So this is your chance to put your questions in there. And we'll start with one that was submitted beforehand here, which I think may be up Dr. Lanata's alley here. But talking about how do autoimmune diseases happen where the environmental factor can trigger the genes that were dormant or impact the genes?
Yes, I mean, that's kind of like that Venn diagram that I was showing at the beginning. I mean, we really don't have the exact how exactly this plays out in every single individual, but I think the hypothesis is that we all start with this baseline genetic risk that it's not enough. We're not born and automatically we develop autoimmunity. It's not like one of those diseases, for example, cystic fibrosis, you have the gene, you have the disease. For autoimmunity, it's not like that. It's like you might or might not. It's just this like maybe susceptibility, and there has to be that like spark, that starts the whole process. And it really is a journey within each person, and it really is hard to personalize what is going to be the trigger. But I think I can generally, I've discussed the things that we've been collecting as in large groups, which have been a few of the things that we already discussed. And it's that combination of both that can trigger the whole process.
So going to our questions from the chat, I think this was from earlier, they put in during Dr. Hasni's talk, but can you talk a little bit about how differences in availability of healthcare for women of color impacts outcomes?
Yeah, so I think it's a very complicated um, topic that why women of color, especially in reference to autoimmune diseases, have poorer outcome as compared to others. And it is multifactorial, and of course, access to health care and access to resources. So health inequality and health disparity both play a role. So no doubt about that. But it's much more complicated than that. There are like multiple other factors. There are genetic factors, there are environmental factors, but then one of the factors is access to healthcare, definitely.
Going back to our questions that were pre-submitted. Um, what do you think are the most important next research questions to be addressed in autoimmune disease? We're going for real easy ones.
So Christina, you want to take that, or maybe I?
Oh my goodness. So I mean, just in a nutshell, we still I feel like scrap the surface of genetics, and that's one of our areas. Like there is genetic risk. I mean, I think that's proven, but we just really understand we're barely starting to understand. And then speaking of equity, we also need to study the worst disease, and unfortunately, there's been this inequity in terms of genetic studies in people that suffer the disease the most. So we need to kind of complete the genetic architecture of risk in people of non-European descent. So we're lacking a lot of genetic knowledge to start with. The second one would be, sure, what factors could we do to prevent the onset of autoimmunity, and see if there's anything we could do preventative. And I think the holy grail, and I think Dr. Hasni would agree, is that for treatment, we're still we're still kind of a little blind in terms of how to choose our treatment. We go through our algorithm, but we're trying to go to what we call personalized medicine, where I could test you for a few things and know exactly what medication is going to work for you, instead of going through a bit of like this process of trying different ones to see which one will be, the best one. And I think we're learning a lot from the oncology cancer world, where they now do sequencing of it's a different process, but they can really pinpoint to exactly the medicine that would be another research need that we need for autoimmunity. Those are my three.
Yeah, and I agree with everything Christina said. I think those are all things that I would say. But I think I just would add one more thing, which is probably more aligned to what this seminar is all about, is increased awareness and early detection. Because I think a lot of especially in lupus and other autoimmune diseases, because as Christina was saying earlier, Dr. Lana, that these are great masqueraders, and a lot of time the symptoms in the early stages are either dismissed by the patient themselves or the providers or others, and they just patients go on without getting diagnosed for a very long time period. So maybe we can go, if we can increase the awareness and then do early detection, perhaps the outcomes can be improved.
So I think this came in one of the seminar questions that got asked, and I also see from a similar question from an anonymous attendee here as well. But what type of physicians work to identify and manage autoimmune diseases, and what sort of testing can be done to evaluate for autoimmune diseases?
So I think Dr. Lanata mentioned in the last slide on your talk about this. So maybe
I think, again, the primary care doctor should be able to be the first, screen. And then we are rheumatologists. That's the specialty that we do. Having said that, autoimmunity is very broad. So for example, the gastroenterologists take care of people that have Crohn's disease and ulcerative colitis. Neurologists take care of people that have multiple sclerosis. And we take care of mostly of the connective tissue diseases, such as the ones that we've been mentioning. But I would say that we are a good first stop. And then we also, rheumatology, again, it's multidisciplinary. We depend a lot on our kidney colleagues, our skin colleagues, So at the end, it turns to be multidisciplinary care, but usually we drive the show at the end. But the primary care doctor should be the first stop. Hopefully not the ER. With the ER, sometimes people get admitted, and then during the admission, also the diagnosis comes to light as well. But certain.
So going to one of our questions from beforehand, we'll go with one of the easy ones. Is there any evidence of any correlation between autoimmune disease and vaccination?
So that is something that I have looked into quite a bit and wrote a paper on that with the infectious disease doctors here at the NIH. So in a just a very short answer is no. If you look at all the data from all the different places, but there are anecdotal reports where at least temporarily, meaning that somebody got the vaccine and then very soon thereafter they had an autoimmune diseases have been reported. But in the in large population-based databases, that has not been panned out. From a scientific point of view, when we think about it, when we are giving somebody the vaccine, we are sort of revving up their immune system. So conceivably, it's possible that somebody who has a background risk of getting autoimmune diseases, when their immune system gets revved up, then they can potentially get an autoimmune diseases. But like I said, in large population-based studies, we have not seen that. And the other point is that autoimmune diseases are extremely rare and are treatable, but infectious diseases are much more common. And when you give the vaccine, you prevent infectious diseases, but there is no vaccine for autoimmune disease. So getting a so I'm all for vaccine. I'll say that do not get vaccine in fear of getting autoimmune disease. There is no conclusive data to support that getting a vaccine can lead to an autoimmune disease.
Great. So we'll go to one of the questions from the live chat. Looking at, I think they're asking about genetics. If somebody has a family member with lupus, what are the sort of risks for their immediate family for autoimmune disease?
So yeah, that's a question that, I mean, I'm sure Dr. Hasni also you get asked a lot of times, and it's not what we call, it's not like a penetrance of 1-to-1, and it's not like you inherit this gene in what we call autosomal dominant. It's very genetic terms. It's basically this flavor of maybe 100 and 150 potential variants that may all work together to give you a little risk of autoimmunity. And we don't even know if that is going to happen in someone's lifetime. So I think the best paper I can remember that looked at this was in Taiwan, where they have the entire population under the same medical system. So they could actually really count the familiar heritability of lupus. At least came out like, I want to say 8 years ago. And I think the overall risk was 1 in 17. Kind of like if I have lupus and I have 17 children, one of them might be, or something like that. It's not something that is one generation to the next. And then I think I also read another question that, there is a lot of people that are just the first ones in their family, and like no one else has autoimmunity, and they're debuting with an autoimmune disease. And that is also very common, that no one in the family has autoimmune diseases, and someone did manifest autoimmunity. Again, is that kind of threshold of based on genetic risk and maybe an exposure that it's really hard to quantify in terms of the actual, and we're still learning about genetics. So we have, I think, an incomplete picture as well.
Yeah, so I mean, I would just add to that if one of the family members have lupus or other autoimmune disease, the risk of other family members is higher than the general population, but it's not an extremely high risk. There's a slightly higher risk or possibility of getting lupus or other diseases. I mean, even the twin studies, and Adam, that have shown that if one twin had lupus, the chances of other twin is high, but it's not 100%, even though they have the same genetic material.
So I think we had go into some of the questions that were pre-submitted. There were a lot of questions about the interaction between mental health and autoimmune disease. Can you talk some about the mental health or stress as a risk factor for autoimmune disease? And then maybe also, as you mentioned, is something that can be involved in disease, ways to try and manage that for patients and how they can help their mental health for managing their disease.
I know Dr. Lanata has worked a lot on this at UCSF, so I would just defer to her to answer this.
No, I think, there's, as you said, Adam, there's two pieces. I want to make sure that, people understand that there are, neuropsychiatric manifestations of autoimmunity. And, that can manifest itself in psychotic episodes, depression, and have bad psychiatric manifestations that's related to an autoimmune process in the brain. So that's in itself a complete different separate topic, but that sometimes has been misdiagnosed as schizophrenia, and it was an autoimmune phenomena. I think we should definitely, as physicians, we always try to not miss a diagnosis and make sure that we don't label a psychiatric disorder without a proper workup to make sure that we're not missing something that could be treatable in a complete different way. And I think there is something to be said about the mood disorders that happen when there's systemic inflammation in the body. So also that in itself might be a trigger for mental health. Just dealing with a chronic disease that is such a mystery, and it could definitely have an impact in someone's mental health. And I think that is all part of things that should be addressed, and as part of the care of anyone really dealing with a chronic illness. And I think it's important because we talked a little bit about the correlation of psychological stress with activating the disease itself. And we see it all the time, like people are fine and then they have, everything is working, and then they come back with a flare, like their whole body's acting up and something, really bad happened, like a divorce or something really difficult, someone died, and then their disease is acting up. So we really have to take care of that component as well. And I honestly feel like we could do a lot better in terms of integrative models of care for people with autoimmunity, because to be fair, there's so much aspects of care that we need to do for people that are suffering with these diseases that it's one physician cannot do it all. So we need our colleagues to really help us out, to try to really make sure that people are well taken care of in terms of mental health for a good livelihood, and also to prevent disease progression. So I think it's a very important point that we're still trying to mainstream in care. Yes. Mm-hmm.
Great. I'm going to go to one of our live questions here from Eloise. She has some background here, but I think the question is about what sort of policy or global things are being done to try and combat some of these environmental agents that may be risk factors for autoimmune disease.
I think that kind of comes to what the Environmental Institute and others are doing. I think it's a huge question, huge problem. Probably, I think at the lowest level, or at the most basic level, I should say, not the lowest, is that we can increase awareness. Awareness with patients, awareness with healthcare providers, and overall people to know that there are environmental risk factors, and then try to avoid them. On a bigger policy level, that's I guess a big question. I'm not sure how to answer that, but I think from a physician point of view, from the health awareness point of view, I guess making people aware and educating is probably the most important thing we can do.
Certainly, there's lots of work going on here and other places trying to identify those risk factors so that people know what they are, what the threats are, so they can avoid them, and the policy can reflect that. Going back to our pre-submitted questions. I think we have two that sort of go together. But in terms of community engagement, how can Black women with autoimmune disease advocate for their health and well-being? And then along with that, what can they do to be well informed about autoimmune disease and autoimmune disease management?
So I'll just want to say something real quick about this because this is something very near and dear to my heart. And then Christina, if you would like to please add to that what I said. So I think this is a big issue, and this is something that we really need to address. I mean, I'll give you an example that I do a lot of community engagement. I do a lot of talks, and I went to a Black church up in Baltimore, and I sort of asked that how many women know have lupus or know somebody lupus, and almost half of the women on this church either know somebody who have lupus or they had lupus. And then the next question I said that do you know that Black women are significantly high have a significantly higher incidence of lupus as compared to other population, and none of them knew that. So even though so many of them had lupus, none of them were aware that they are disproportionately affected. And to me, that was an eye-opening moment because they have sort of internalized that fact that they have lupus and they know the cousin has lupus or aunt has lupus, and there's so many have lupus without even realizing that they are at such a high risk for lupus. So I think, again, my number one thing is education awareness, education awareness. I think that is the number one thing that, especially for Black women, to know, to look to advocate themselves for themselves if they have symptoms which are somewhat non-specific, that may be suggestive of lupus, then to if the family members or the primary care physician is dismissive of their symptoms, to advocate for themselves, to empower. So we need to empower them with knowledge, with awareness. So when the next time a 20-year-old Black female comes have a hair loss, or if have a skin rash or feeling fatigue, she doesn't get dismissed as it's all in your head, and not get diagnosed with lupus for 5, 6, 7 years. So that's to me, I'm very passionate about this, and I can talk and talk and talk about this, but this is something to me is like, to increase awareness, to join groups where women with lupus have a lot of these community groups where, a lot of organizations, Lupus Chat, Lupus Foundation of America, a lot of patient advocacy groups. So awareness among the women, then also at a policy level, talking to your representatives, talking to healthcare providers, and so forth. Christina, you have anything to add to that? Sorry, I just very
No. I think you said it all.
okay.
Great. I know that's an important point here. We have a question from an anonymous attendee. Does the increase in drug and food allergies indicate a potential of increasing autoimmunity?
Allergies is interesting. It kind of affects another arm of the immune system that is a little different than just mounting a direct attack to some molecule. Having said that, there's a lot of overlaps with people that have autoimmune diseases. So, for example, bad eczema and bad skin reactions. But in general, they're a little their own kind of category. So we tend to think them as separate phenomena. So yeah, in general, not necessarily. I would not be thinking, oh, this is turning to be an autoimmune phenomena just because of having allergies. It's like a different genetic predisposition, a different genetics or a different arm. Yeah.
I'm going to pass it back to Joan here. Thank you so much for taking people's questions and your time here for speaking. I'll let Dr. Packenham finish us up here. I'm sorry for people's questions we didn't get to.
I'm trying to unmute myself. Adam, did you I'm not sure that I heard you ask the question that was about Hashimoto's. Did you
I did not
get?
ask that one. I was gonna
Okay.
type in chat.
Hmm.
I was gonna type things for some of these while you were talking.
Okay, did you type it in the chat?
Not yet.
Oh, okay. All right. But if we have time for one more, that would be one great one to ask if you like.
All right. Can somebody want to discuss what is the best specialist for Hashimoto's?
I think probably endocrinologists will be the best person. Those deal with Hashimoto's disease probably would. I would go for an endocrinology.
Yeah, it's just like a localized organ that they handle very well. It's like sometimes they have more systemic this manifestations, and they might ask for help of a rheumatologist, but in general, the endocrinologists do a really fantastic job taking care of autoimmune thyroid, not only Hashimoto's, but Graves' disease, and there's some other autoimmune diseases that only occur on the thyroid, and they usually take care of those.
Thank you very much. Thank you so much, Dr. Hasni and Dr. Lanata, for such a this was a phenomenal informational session where Dr. Hasni, this was educational awareness for women, just like, what our passion is to make sure that women are aware. That's one of the best things so that we can get the word out there so people can be diagnosed earlier, so they can recognize their symptoms and say, hey, what about testing me for an autoimmune disorder? That is incredible. It was just an incredible session. So thank you so much. So do you see my slides? Can you see the autoimmune disease resource slides?
Yep.
So I just want to remind everybody that we do have the resources that are available to you and located on the Women's Health Awareness website, and that will be placed on the website in the future. Also, this webinar was being recorded, and that will be on the website as well when when the government 501 compliant. So it takes a minute, it takes a couple of weeks for that to happen, but it will be on the website. So if you have individuals who should see this webinar, that it will be there for their viewing at their leisure. So evaluations, immediately after the webinar, evaluations will be sent via email. And for attending the webinar and completing the evaluation, you will receive educational contact credit hours for your participation. Congratulations to Jamila Kelly of Holly Springs, North Carolina, who was the raffle winner for November's webinar. So we congratulate Jamila Kelly for winning the raffle for the November webinar. So there you go, Jamila. I want to remind everyone about the 10th Annual Women's Health Awareness Wellness Conference. We are excited about our 10th anniversary celebration and conference. Please save the date on your calendars, but also register, as this is a free conference and pre-registration is open. And for the link, it will be placed in the chat for your convenience. The conference will take place at Hillside High School, that is located at 3727 Fayetteville Road in Durham, North Carolina. Our next webinar will be February the 8th, 2024. So the webinar will focus on women's heart health, and we hope to see you in February. Thank you so much for joining us this evening and for this very important webinar on demystifying autoimmune diseases, what you need to know. We hope that the information that you have received will help enhance your daily lives. And as always, thank you for your continued support and attendance. Have a great evening. Be well, stay safe, and have a great night. Thank you so much for coming.